And we are live. Good afternoon, everyone. For those of you joining us, welcome to our fireside chat. We'll give a couple of minutes just for everyone to join in, settle down, get their cup of coffee, have a bit of lunch on the side. Whoever is wrapping up a call, this is your time. Whoever is typing that last two lines and two sentences in an email to click send, this is your time. And then we'll kickstart straight away. Just as a quick introduction and a quick overview, today's fireside is going to be a little bit more interactive. We would love to see a lot more comments, questions. If there's something you feel might be interesting, if you agree with something, if you disagree with something, please let us know. I'll be keeping an eye also on the comments. So if you have any comments to the speakers, and if you have any questions you want to bring, please let us know. We're also going to be using Slido during today's session. So it's an interactive tool, very simple. You can just follow the link, use your phone to follow to click the QR code, and we'll be asking some questions to the audience just to also see what are some of the insights that you're bringing to this conversation. Ideally, by the end of today's fireside, I would have learned a lot from our speakers today, but also we collectively would have a bit more insights from your contributions as well. All right, it's 2 minutes past 12. Sam, Kevin, how are you?
Very well, Noor. Thanks. How are you?
Very good. Kevin?
Yeah, and I'm feeling a bit cold, but looking forward to this fireside chat to warm me up.
Perfect. And just to keep everyone aware, where are you in today? Where are you calling from today or joining today?
So I'm in Burnt Island in Fife in Scotland.
I'm in Hampshire, so England.
And just to spice things up a little bit, I'm in Cairo.
You always have to outdo us with your location, Noor.
Yeah, absolutely, absolutely. The weather is absolutely terrific. It's winter here in Egypt, 23 degrees. So we can't really complain. Before we just get straight into introductions, I thought maybe it might be valuable to let everyone know how this conversation actually and how this fireside actually started. For those in the audience, my name is Noor Hussain. I look after growth in Meddbase. My background academically is in genetic engineering and biotechnology. However, I spent the last 15 years working in various technology, healthcare, and occupational health organizations. I was very lucky to be on a call with Kevin and Sam, and the conversation was so insightful that we felt this would be really relevant for a lot of our customers. This would be really relevant for a lot of professionals in the industry. And we thought, why don't we organize this, bring in a group of industry experts from various areas, HR, occupational health, technology, operations, and discuss some of the synergies and the insights that we have. Obviously, this came off the back of a white paper that Dr. Kevin had released with SOM and CIPD, which if you have not downloaded and if you have not read, I highly recommend it for the medical professionals and the non-medical professionals. It's definitely a beautiful piece of work that gives some really valuable insights, and hopefully Dr. Kevin can give us a bit more details today. Before we get into introducing, and I can ask the speakers a little bit about themselves, we'll start a little bit with just giving and getting a bit of an overview on the audience piece. So on the next slide, you will be able to see some details about Slido. As we said, if you go to slido.com, you put in the number in there, you should be able to access the Slido page for this fireside. If you have a mobile phone, you can click the QR code and you can keep that on your phone. This will remain throughout the fireside, so you can keep the same link open, and we'll be switching through to questions, and we can see the responses from everyone there. Now, maybe we can go back to a bit of introductions. So you'll see on the screen, there's the introduction about Dr. Kevin. Dr. Kevin is a chartered psychologist and a senior lecturer in organizational psychology at Birkbeck University of London. He's also the executive officer of the European Academy of Occupational Health Psychology. Kevin, what is it that when you introduce yourself, you find or you feel is the most important for people to know about you?
Oh, that's an interesting question. Thank you for the introduction, Nora, and thank you for the invite. I would say, as a psychologist, actually, ironically, over my career, I've become less focused on the individual, but much more on the system that individual or that teams are situated within. So actually, what I'm really interested in is how workplaces are designed, organized, and managed, and then what impact that then has on the health, well-being, performance of individuals and teams within those environments.
All right. Well, that's quite exciting. I think one of the things I find also quite interesting from the work that you've done is the level of detail that you have, not just on the occupational health, well-being, intervention programs, etc., but also not taking it just from an academic perspective, taking it from a very applicable perspective, application perspective, knowing how organizations are looking at this and what challenges they're facing and how they can overcome that. So I'm looking forward to picking your brains a little bit. Thank you very much, Dr. Kevin. And our next guest, and dare I say friend, is Sam Wood. Sam's the head of product at Meddbase, and he is, or we would like to believe that he's an accomplished and passionate product manager. Sam has a very unique blend of expertise in software development in healthcare sectors. He's got about 6 years in software development and a 9-year journey in the healthcare industry. So Sam is always internally, he's our product guru. He's absolutely adored and loved inside and outside of Meddbase, and he sits on that cusp of healthcare technology. And I know that on a day-to-day basis, Sam speaks with multiple organizations, and he tries to understand what's out there and how can we better serve the industry. Sam, I'm going to ask you the same question I asked Kevin, so hopefully you've had a chance to think about that and be less surprised. When you're introducing yourself to people, what do you feel is something that's important that you'd like people to know?
Again, it is a very good question, and I think it's a strangely linked answer to Kevin's. It's the fact that working in product at a software company that serves healthcare organizations often means thinking about systems of healthcare and service design in healthcare, and obviously how software can meet those needs. And I think that that's something that I'm quite passionate about, that I love talking about, and that I think that when talking to new or new organizations or people I've known for a long time is something that is always, a really rich avenue of discussion.
Fantastic. And now we'd like to know a little bit about you. So for everyone on the fireside and on the call with us today, feel free to pop into the comment section. Let us know where you're based today, where you're joining the call from, who you are. If you don't mind sharing this information, obviously we won't share it with any third party, but we'd love to get a feel of who's also joining us in the conversation. So happy to see any comments from everyone. In the meantime, definitely not the most important piece, but welcome everyone to the fireside. My name is Noor Hussain, as I said. I'm not the smart person on this call, so I'm actually going to be trying to learn as much as possible. I look after growth in Meddbase, and as I mentioned earlier, my background has been in genetic engineering, biotechnology as an academic. However, I've lost my way into the business and technology world, and currently support a lot of the Meddbase customers in finding what would be the best and the ideal software solution for their requirements. Now, we'll jump straight into the Slido. So this is your chance to give us a bit more about yourself. We would like to know a little bit about the area that best describes your role. So out of everyone on the fireside today, which area best describes your role. So so far, there's a couple of votes, and we can see the breakdown is about 50% occupational health and operations. So feel free to join the Slido and let us know which area best describes your current role. And while we are doing this, maybe a quick question to you, Sam. You work closely with a lot of organizations. Who are the most common profiles that you're interacting with on a day-to-day basis?
It is very varied. I think most commonly I'm speaking to a mixture of sort of healthcare delivery teams and a lot of sort of operational teams across, across the whole breadth of healthcare from all sorts of different industries. I think those are the most common ones.
Perfect. And Kevin, I know that part of your research involved engaging with different professionals and different organizations. Who do you usually engage with, whether as part of your research or even within academia?
So just to clarify, do you mean sort of target groups as sectors, or within an organization, the types of people to work with?
Both. I'd be interested to know both. Yeah.
Yeah. So I think a lot of the work that I do has traditionally been in the healthcare sector, so looking at supporting the health and well-being of healthcare workers, so doctors, nurses, midwives, other frontline workers as well. But as someone who's just interested in the world of work in general, I do a lot of work across other sectors too, so that's financial services, public sector, the legal sector, the charity sector as well. And I think one of the things, going back to what Sam said earlier about that systems perspective, is actually trying to deal with the right people who are involved in managing those systems. And actually some things that we might touch upon later is that's whether it's occupational health, whether that's HR, whether that's operations, whether that's senior leadership teams. Actually, it really varies from one organization to the next. And I think a key area is trying to work out who's got the right roles and influence within these organizations.
Very interesting. And I think off the back of that, it seems, and rightly so, that we've got a very large constitution of occupational health professionals on the fireside and on the call, which is great. That's the right place to be. This is the whole point of this conversation. There's about 45% describe their area that is also operations, and I can imagine that it's either from an occupational health provider or an operations management piece within an occupational health team. I think we've got the next question on Slido as well, and that's just to try and get a feel and an overview of the primary focus for the occupational health initiative. So feel free to give your responses, but in the meantime, Kevin, I wanted to ask you something. On the report that you just was working on, there was a lot of focus on the most effective interventions to improve workplace mental health. And obviously we know and understand that a lot of the employers and occupational health teams are really looking at how can we really identify what works, right? There's so much noise now on mental health, well-being, interventions, and no one denies the value of occupational health and human resources and working together to make sure that there's a really viable and successful mental health and well-being program in the workplace. I want to ask you, how do organizations, or how should organizations start looking at designing these programs and interventions? It's a very broad and general questions, but I want to make sure that if we've got people on the call today, I want to make sure that they can get assurances that I'm doing the right thing, or I'm starting from the right place, or actually this is not how we're doing it. Maybe we should consider something else.
That's a really interesting question. So I think to start off with actually is to recognize that well-being or health just isn't a siloed issue. It isn't one issue that it's under the responsibility of one group of people. And equally, there isn't one intervention which is going to work. Often organizations or practitioners says, well, should I run this training program? Should I offer this service? Is that going to help my issue? But actually, what we would encourage organizations is take a step back and say, well, when we say we struggle with well-being or with health, what do we actually mean by that? What does that look like? So how can we actually understand better what the problems are? And in doing so, also, who are the people involved in helping us understand and make sense of this? And whether that is frontline employees, whether that is representation from different stakeholder groups as well, but having a conversation and a dialogue and having information from different sources to understand actually what really is going on is essential. There's a tendency of trying to jump in too quickly and doing something without actually taking a step back to say, what is the issue before we make a proper start.
So does that mean starting from the end? Does that mean we're copying something? Because I feel like a lot of times this is a challenge that maybe particularly teams that don't have a full occupational health unit that would we were talking about this earlier, that they kind of find this aesthetic solution of, well, let's put a mental health awareness session for the employees, for lack of better examples. Is there a way we could take a more methodical approach?
Yes, I think we should be taking a more methodological approach to try and understand what is going on. And I think too often there is a tendency from organizations, and it could be for different reasons. It might be because they're generally concerned about the welfare of their employees, or it might be because we just want to appear that we're doing something and managing, and because of a lack of awareness or understanding of actually what we mean by health and well-being, and what some of the factors are that contribute to whether it's good or poor health and well-being, then it's going out and saying, well, this is what others are doing. Let's try and copy that. Or this is what we've seen. This looks very nice on a fancy brochure, and it's promising certain outcomes. And actually, let's try and do that. But without actually considering and saying, well, is my environment and my context and my issues, is that the same as what the other organizations are going through as well? And equally, just because everyone is doing something doesn't actually necessarily mean that it is any good. So we need to have a better understanding of what our issues are and how we can then develop appropriate solutions on the back of that.
And how do we start finding out what our issues are? Like, is that a surveying process? Is that
I think it would vary from context to context. I would almost say that trying to make sense of any types of information that you can get is better than just going off gut instinct. So, I mean, from a UK perspective, the health and safety legislation would specify the onus is on the employer to carry out risk assessment. So, what that risk assessment looks like would vary. So, whether it's something like the management standards from the health and safety executive, whether it's an employee survey, whether it's looking at other organizational or HR data to try and make sense of actually what is going on. It could be more informal, whether it's focus groups, other channels in which employees are able to feed into the process to try and say, have an understanding of what's going on, what are our issues, and then using that as a starting point to say, look, some things are coming up. We might need to do a deep dive into these certain areas, or maybe it's saying, look, some things are coming up, but actually it's not mapping out what others are saying is the way we're collecting data, is the type of information that we have actually even appropriate and relevant to what we are trying to do.
I think, sorry to jump in there, but I think that's another really interesting crossover between sort of my experience and Kevin's of, if you don't understand your requirements up front, and you don't, you're not sure that your requirements are correct, then the thing that you build at the end of it, the outcome that you achieve, isn't going to be the right one. And it's really interesting, having these conversations with Kevin and the ongoing discussions that we have with all sorts of different organizations, that spending the appropriate amount of time understanding the problem at the beginning of the process is so valuable in making sure that you get the right outcome.
And I think that the key there in what Kevin was saying was data. The moment Kevin was talking about that, I instantly thought of the systemic approach to managing mental health and well-being. And Kevin, you talk a lot about that. I'm going to ask I'm going to ask you just a thought on the systemic approach, Kevin, before I get to Sam on the systemic, like the technical systemic approach. So you spoke about, you wrote about the different primary levels, secondary levels and tertiary levels of intervention, all the way from prevention, support, rehabilitation. Is this something that any organization could do, or do you need to be of a specific size, a specific scale, a specific risk category? Is that a massive piece of work, or can any organization actually define and start setting intervention levels that are suitable for them?
So I would argue that any organization can and probably should be working across these different levels. And when I talk about taking a holistic perspective, this is what I meant. Just to recap, if anyone's not familiar, this is very familiar to those in occupational health or public health backgrounds, is the idea of taking a primary approach, prevention really. What are our risks? What are our issues? How do we prevent them? Secondary interventions, which is about supporting, how do we support our workers to deal with those specific issues so they're better equipped to do that. And then finally, tertiary, which is around rehabilitation and restoration. So individuals who might be hurt or might be unwell, how do we then bring them back into a place that they can get back into work? And I think too often what we see is an imbalance where we think that managing health and well-being is about the back end. It's about saying, look, we have access to an employee assistance programs, we have access to GP referral services, or we can sign people off and then they might go see their GP and might be put on medication, but that actually doesn't address the underlying issue. So what we need to take a step back is saying, well, what are our issues? And that goes back to risk assessments and the use of data. How do we manage that? How do we support our employees as individuals to deal with that? And then also alongside that, when we have individuals who might be struggling, who might be going off sick, how do we then support them and also longer term bring them back into the workplace?
And I think that's a very interesting point that you raise as well, that I find myself often in similar conversations where a lot of organizations would have their own correct, methodical, medical, clinical, occupational health program, and then their challenges and their pain points are often not really medical or clinical or occupational health, but sometimes it's system, sometimes it's engagement, sometimes it's communication, it's tracking. So I want to ask Sam about the systemic approach towards interventions in general. You deal with a lot of software, you engage with a lot of companies, you know what organizations are using, not using, etc. Is there a way where software or technology can help improve the systemic approach towards prevention or intervention?
I think so, yes. I think that it often comes down to the gathering and the collection and the sort of aggregation of all of that information. And software is particularly good at doing that, where and then presenting that information to people in a way that allows them to make the right decisions, design the right services, tackle the right set of programs. But I think certainly, this is a particular area of interest for me, but the sort of collection and appropriate presentation of data can really, really help with making sure you're designing the right sets of programs. And I think that software is fairly uniquely placed to allow organizations to do that in a way that is, efficient and cost effective and works for users as well.
So how do I know if what I already have in the systems that I have are sufficient, and when should I start realizing that these are red flags? I'm lagging behind everyone else.
That's a really interesting question. I think there's probably not one answer to it, but I think that most people probably feel a set of pains around systems that they use, and it's about making sure that you're monitoring those and comparing them against, what your goals are. Like what again, going back to that, understanding the problem that you're trying to solve, and then comparing that to how your systems are performing now, and making sure that the really important things, identifying the right set of interventions, collecting the right data, presenting it in a way that works for users, and loads of other things as well, obviously, but making sure that those are being solved by the systems that you have in place.
Okay,
Can I just jump in?
of course.
I was just going to say, and fully agree with what Sam says, and I think there's also a flip side to that, is if we have systems which are not appropriate or fit for purpose, then they actually become a source of problem, and they become a source of strain. And particularly when we're talking about mental health and well-being and the workplace pressures, that can be a massive demand on individuals and for teams within it. So rather than it being a resource, it actually becomes a source of a problem.
Absolutely. I mean, particularly working in the healthcare space, right? Like where the people that you're supporting through mental health and well-being, a lot of their job is spent interacting with software and systems, and so it's really important to continue to analyze: are they working for us at an organization level? But are they working for the people within our organization? Are they helping or hindering?
Yeah, absolutely. And I think we saw on the screen earlier on Slido what the primary focus for the audience on the current occupational health initiatives, and we could see that pretty much the majority was focusing on preventative health measures, and obviously many of these are designed to make sure that we can reduce, the need for mental health supports or workplace safety or even chronic disease management as well. So obviously prevention is massive, and we're going to ask a couple of questions, or the next question, and at the same time, thank you everyone for the comments. Alice, Anne, Louis, Ali, Jansu, Sandra, thank you everyone for the comments. It's very nice to see where everyone is joining from. If you have any questions, please feel free to post them in the comments, or also if you have any comments on anything that you've heard today. On the next question on Slido, we'll just be asking the audience to share a little bit about the aspects that they think is really the greatest challenge for them in promoting employee well-being in their organization. And while we get the answers, I want to ask you, Kevin, on something that's more specific to HR and occupational health. So today we wanted to talk about, one of the points was about that synergy between occupational health, HR. You also wrote a lot and spoke about creating an open and inclusive culture. And sometimes organizations might fall in this pit or challenge of, there's human resources and there's occupational health. You do your job, we do our job. You have some things to report on, we have some things to report on. And oftentimes there are glaring gaps. What do you think organizations that have that very clear separation and lack of synergy or inclusiveness, what are they missing?
Well, we could go on all day talking about this, but I think one of the key things is actually not having a joint up approach, and whether that is having a formal plan or a strategy which actually brings together these different functions. I was quite curious in the previous question on Slido, which talk about preventative measures, what actually those measures might be within the organizations of those who are listening in today, because really what we're talking about is organizations which are better run. So that's partly to do with HR, it's partly to do with occupational health, but even other functions as well. You might have organizational development, but really all of that comes back to leadership. In a large organization, that might be then your senior execs. It might be something like an organizational strategy. How are we actually looking after our people? Is there a joined up approach within that? Within smaller organizations, then it might be more informally, but again, it goes back to leadership. Are our leaders connecting the dots between the different functions? Are the different functions able to speak and communicate and learn from each other as well? So is there a platform for collaboration? I think that's really important.
And you're talking about a joint up approach. What? Why is that joint up approach important? I'm not actually. I'm actually quite curious. Uh, like, why is it important for the organizations? Is there something they're missing on reporting, or something they're missing on data, or is there actual benefit to the employee well-being and safety?
Yeah, I think it's a benefit for everyone, and I think it's also complementing the skills and the experiences and the expertise of the different functions. I mean, if we talk about occupational health, particularly around mental well-being, someone might be signed off and saying, due to high workload, they might be signed off with stress, depression, anxiety. Occupational health might perhaps work with them and say, actually, what we need is a phased return. We need to talk about workload in the environment. A line manager or HR might say, well, that's not going to be possible. So therefore we're going to park that. And then the same individual is going to go back to the same environment and probably struggle again. And then it's not surprising that if they get signed off again over a longer period of time. But if we are looking at what are some of the antecedent factors that lead to particularly poor health and well-being, mental health and well-being, then actually it's things like, workload, work pressure, bullying in the workplace, having support, having clear work roles, good developmental opportunities. And often that is a function which might be set by HR or a people function or a people strategy. So OH should have a role to play in influencing that as well, because they otherwise they might be seen as actually our employees are struggling, go and see OH. But OH can do so much, but it can do so much more, and actually reviewing existing policies, procedures, protocols, systems to say, is that working? Is that not working as well?
Yeah, and I think sorry, Noor, to jump in again, but I think the danger that Kevin's highlighting there of, if you do not have a joined up approach, there is the risk that those two functions pull in separate directions. And again, it's sort of flipping that what could be a real benefit to employee well-being into potentially a negative factor on it. If you are joined up, on the other hand, and you are communicating between those functions and you have a shared strategy, then you can start benefiting each other's function. And HR can benefit occupational health and vice versa. So it's, do you want to be in a virtuous cycle or do you want to be in a vicious cycle?
Well, I mean, let me challenge that. How do I know if it's not joined up? I mean, I could be a member in an occupational health team or an HR team, and yeah, we're pretty joined up. HR does the recruitment and PPQs, and we do the case management, and they kind of send it over to us. We're pretty joined up. On a quarterly basis, we meet to discuss things that we want them not to do, and they let us know things that we want them not to do. And what is a joint up one like? How can it be better? Does it get any better?
Well, I think actually one of the things that is frustration. I think you probably know if it's not joined up, and there'll be an element of frustration, because if you're working in OH and you are dealing with individuals who are coming across and saying, look, we're being signed off, or we're struggling with issues around workload, around bullying in the workplace, around conflict in the workplace, and that's actually information that you're aware of that is actually about the wider system. And then what's happening is either that information is not being transmitted back to HR or people functions, or then is being ignored by HR and people functions. And equally, if you are in HR and there isn't a strong collaboration with say OH or with OH functions, then you might be perhaps looking at stuff around retention data, looking at sickness absence data, and then going, actually, this is quite high. Why is it that we're investing in this well-being, whether it's well-being services, OH services, other intervention programs, but actually we're not seeing the outcomes that we would like to see. So I think it's about maybe taking a step back and looking at a bigger picture. And I think maybe going back to what I said earlier about having a sort of a people strategy and an idea of what we want for our organization, to say, are we actually meeting that? If you're very task focused and say, all I'm doing is processing applications coming in, making sure people are paid, people get promoted, processing it from a very administrative perspective, then yes, you might see the bigger picture. But I think we're in a place where most HR and OH teams are looking at what actually is the wider picture. And in doing so, I think it's very hard to avoid those types of questions.
I mean, it reminds me of a short story. I worked for a tech organization, and at some point during the time, the workload was really high and it was very stressful. So I reached out to our HR team just to see, how can I help manage this stress, because I'm working 10 to 16 hours a day, and can't really seem to be managing the workload. And the recommendation was for me to attend a series of online sessions that is adding another 2 to 3 hours to my weekly workload, which was causing more stress to me than, because I couldn't back out. I couldn't say thank you. I don't want that support. But there's a question we've got from Alice, and I hope we can highlight it here. And maybe that can be to both of you. But Sam, maybe you can also talk about that from a data perspective. So Alice is asking, do you have any recommendations on how to measure the success of a joined up solution? Which I think is a really good question. How can we measure that? And back to Kevin's point on prevention.
Yeah, no, I agree. It's a great question. And I think that there are multiple ways of tackling it. The one that came to my mind, first of all, is exactly as you said, Noor, it's quite data focused, and it's about measuring, outcomes, and the level of recurrence of people seeing occupational health, for instance, might suggest that there is a lack of a joined up approach where people are being, seen for the same issue, or, being seen for stress multiple times over the course of the year because that return to work phased return to work plan wasn't approved, as an example. And I think data can certainly help us there, in terms of data that we're collecting anyway, as part of the process of running the occupational health and HR services within an organization. And we can sort of repurpose and reuse that data to help us measure, whether our joined up solution is working. I think there is also lots of other things that you can do, though, around, engagement, and I think, as Kevin, you mentioned, if it's working or not. Like the sentiment of the people involved will tell you whether it's working, and making sure that you track that and that you're paying attention to it, I think, is really important. If you go down the route of, okay, we want to make sure we're doing this joined up approach, and we want to make sure that we're measuring its success over time, I think measuring people's sentiment is really important.
I think if I come in there, I think at a very basic level, it's what are the metrics of importance. So, a simple one is, say, sickness absence. So actually, as an organization, are we managing sickness absence? Are we managing retention in the workplace? And if we're not, then actually, what are the reasons why that is not happening? What do we think as a function that we're not able to deliver? What do we think the other function might be able to do better, or to do differently? But I think a good place to also start is to actually sit down between OH and HR, and again, other stakeholders as well, to say, what are we doing? What are you doing? What can we offer? What we would like to see from the other side? Because I think having space to actually talk about how we're going to work together is really important. And that could be something on a very informal basis. But again, it could be in a larger organization. You might need something which is a lot more formal, which is a lot more process, and a lot more process driven. And I think as part of that is looking at what systems do we have that overlap, what data do we have that overlap, and then what are also our existing gaps between us. What do we need to fill? Whether it's a gap that we fill together, or one function needs to fill on its own. And then it's regular evaluation of that, and then saying, look, whether it's checking in 3 months, 6 months, 1 year from now, it's saying, look, these were things that we thought we're going to try out to try and improve how we work together. Is it working? Is it not working? And then using that as a basis to try and enact subsequent change as well.
Perfect. And I think there's a lot of time when I speak with occupational health teams and professionals, and I'm not saying it's not true, but there is always the sentiment that the executives want to support employee health and well-being. There's, of course, employees are, the most important asset for every business. But then when it comes down to actual actions and implementations, they're not ready to fund it. They're not ready to support it, resource it properly. It's in many cases, it's an afterthought. You're being asked to do more with less resources, but also you're very much always at risk of mismanaging something that could cost the business really, really well. So it's kind of like when things are going well, no one's really complaining. no one is really giving you credit to the prevention programs and that you're running and doing. It's only when things go bad that everyone's, what are you doing? And I think we've got a question on Slido, just to maybe tackle a piece that sometimes I get quite often in conversations, that's around the interaction of technology. One of the things I find always quite interesting is the utilization of HR solutions or software for occupational health purposes. And oftentimes it could come in specific sectors, in financial services, a lot of the sectors and services where the occupational health need is growing, where, 15 years ago, no one would need mental health programs in, or maybe 20, 30 years ago, they wouldn't need that in a corporate setup because everyone was mentally okay, or at least they thought they were. But now there's a lot of that requirement for HR teams to take on more and more of the well-being program and the well-being agenda. And I think the question that we have here is for our audience and for the guest is, in your interaction with technology, different softwares that you use, how do you assess their understanding of your challenges? Do you feel that they've got sufficient understanding of what you do? And Sam, I know you've got a couple of good examples from a lot of the meetings that you have on the difference between a solution or a software that can do what you need from an occupational health perspective, and an occupational health software that is designed for you. How do I know the difference, or why should I even look for something that is fit for purpose?
Yeah, I mean, a really good question. Again, I think that
Thank you.
why you should look for something specific, I think does go to that point that the people in the call are making, that if your technology provider doesn't understand your challenges that you're facing and the requirements that you have of software, then the danger is that the software or the solution that gets deployed there doesn't go far enough in meeting the needs in a way that will actually benefit the organization. And I think that that's something that, I'm biased, I'm a product person, so I'm kind of all about what is the requirements of my user base, right? But I think that it is so critical that whether you're an occupational health provider, a HR professional, really any walk of life, when you are looking at a software provider, it is so important that they understand who you are, the challenges that you're facing, and the requirements that you have, because that is going to, in so many subtle ways, affect the product that they're building and deploying. And it can be something really simple as something as simple as understanding the language that you speak, in terms of workplace conditions, in terms of the types of screening that you do. Having a deep understanding of what those things are does have many subtle implications of the way that you would build a solution to meet those needs, because you have to understand the end-to-end of the process in order to make sure that you're joining things up correctly, that you're talking to the right people at the right time, that you're asking the right user to do the right thing at the right time. I think that goes deep into understanding the challenges that those teams face.
And what does that look like in practice? So if on average, how many software, different tools should I be using to manage my end-to-end cycle? What's a good number?
So I don't think there is a single answer to that. I think that there's kind of two general approaches you could take. 7. I think that there are two approaches that you can take. You can take the best of breed approach, where you say, I want the best possible communications platform on the planet, and I want the best possible EMR platform on the planet. And then I'm going to do a lot of work to join those things up, because I can't not join those things up. Otherwise, I'm not going to solve any of my problems. And that is definitely something that in the past, loads of people have gone down that route of, let's buy lots of off-the-shelf bits of software and then tie them together within our organization. It definitely can work, it definitely poses a unique set of challenges for teams deploying them, for organizations that continue to run them. And so the other approach is let's find a solution or a software that captures as much of the journey as possible. And that means that it's all in one place, that it means that it all talks to each other by default. If you take the best of breed approach, you need to start thinking about words like interoperability. And are my systems going to speak to each other correctly? And am I going to be able to get the data from all of them in a way that allows me to join those dots when we're talking about measuring success and assessing risks and using data to power our service design? You need to be thinking about that when you're choosing what route to go down there. Because I think if you lose sight of those requirements, you're not going to end up with a successful deployment of software.
I was going to come in and talk about technology more generally, if that's okay.
Yeah, please.
And almost, I guess, a word of warning when it comes to technology, and it's very, it's a crucial part of how organizations are run today. I think one of the challenges many organizations have is trying to decipher between what's good and what's bad, what's popular versus what actually we need. And sometimes, again, going back to what I said at the very start, having an understanding of what we need will then help try and pick the right solution and the right software that comes on the back of that. And if we end up with the wrong software, with the wrong technological approach, then the danger is that we might have something which is almost just for show. We're doing this just because we're showing that we have this, that everyone else is using it. This is what is expected, but we're not using it to its full potential. And that is, again, problematic, because if we're talking about environments where people are time poor, then actually, the technology again becomes a source of problem. And sometimes even we have issues around employees becoming cynical. I've come across in my experience where people are saying, I'm having to fill out all of this data, which I know is not going to be used. So what's the point? Actually, it's a waste of my time from that perspective. And then the organization loses out, because I think there is so much where different functions, whether it's HR or OH, can look at data and say, well, this is quite interesting, and this allows us to act on something and tries us to drive solutions which come later on as well.
No, I completely agree. I think it's very easy for technology to get in the way, particularly since COVID. Actually, people have been looking to software to solve all of their problems, which in some ways is great. There are lots of things that software is great at doing, but I think that it's very easy for technology solutions to get in the way of good service design, and particularly those areas that you highlighted, Kevin, around people becoming cynical about the use of technology, people having to spend too much of their time on a computer writing things into a form, as an example, that means that you lose out on adoption. And if you don't have employee adoption, if you don't have that set of champions within your organization and a system that doesn't get in the way, or a series of systems that don't get in the way, then you're going to lose out on some of those great benefits that we've been talking about.
Yeah, and I think going back to then having that more holistic, joined up approach, it a good system would allow for that if the organization is also aware of what that system can do, and I guess also has the expertise and knowledge of how to maximize the utilization of that. I come across a lot of technology providers. I mean, this is slightly different, but let's talk about, we have a well-being issue. Here's an app service. You can download an app. It measures your well-being. It says, look, you're struggling on this level of well-being. You've got high burnout. Here's a webinar to watch. Here's some self-care tips for you to do. And that's a very individualistic approach, because again, you're putting the onus on the individual. What I would like to see over here is at least that there's a feedback that goes back to the organization and says, look, your employees have downloaded this app, X% are saying that they're burnt out. What are you going to do with that information? If you're going to say, again, signpost and say, continue on with the app, here's some videos and stuff to be watching, or actually are you going to take it back and say, look, our employees are struggling because of burnout. Why are they getting burnt out? If they're saying it's high workload, what can we do on the back of that? And I think using that to kind of close the cycle and inform activities which around prevention and creating better working environments is really important.
But isn't there a risk? I mean, isn't there a risk in setting an expectation with the employee that this data is going to trigger an action? I mean, I'm just thinking, I'd much rather say, here's an app, we're providing it, download it. If you need assistance, it'll help. Whether you use it or not, that's absolutely fine, versus sending out a survey and asking you, how valuable is this? How stressed do you feel? Because it builds the expectation that, well, I told you I'm stressed, what are you going to do about it?
I think it goes back to looking at how you're collecting data. If you've got different streams, then it's about saying, well, which are you going to prioritize and why? If your technological approach is your primary approach, then actually in a way it has to be fit for purpose. And as I said earlier on, at least in the UK, the onus and the legal responsibility for employee well-being is on the organization. So if employees are feeding that information to an organization, actually they have a legal responsibility to act on that.
And I think as well that sort of speaks to having a joined up approach as well, right? Like, don't deploy a software solution that will gather some data if you are not prepared to act on it. Like, you know, set the goal first, understand your requirements and your risks first, and then deploy solutions, whether they be software, process, you know, people-oriented things that are going to work towards that goal, and understand where you're going with it, and understand that, you know, yes, you know, HR might be responsible for collecting data, but it should be, it is going to be fed to occupational health for this purpose, and vice versa, right? Occupational health are going to collect outcome data, and it will be fed back to HR, and here's what our plan for dealing with that is. And doing a bit of forward planning in terms of the service design can enable the software to give you more.
And I think there's a lot on what you said about collecting data, and there's a question we have about data concerns and employee privacy. Obviously, it's a big concern for a lot of organizations, for a lot of individuals as well, how my data is going to be processed. But I'll park that question because I'm conscious we've got about 10 minutes left, and which is a chance also to open up for any questions from our guests. I wanted to ask a bit of a question that I promised myself I'm not going to ask, because I don't necessarily really think it's a very powerful question, which is about AI and all the buzz around AI and what is AI going to do to replace humans, and specifically in the occupational health space, we've seen a lot of businesses and organizations automating, PPQs, or automating specific kind of, areas of either case management or periodical health screens, etc. And the question that I already feel so pained in asking it: do you see AI replacing humans anytime soon in this domain or in this space?
Personally, no. I think that there are lots of things that technology is really good at. I think that some limited automation in terms of automating the tasks that always have the same outcome can help teams free up time to do more of the things that humans are best at. But I personally don't think we're anywhere near AI replacing the human in this kind of process. I think that, actually going back to Bushra's question around data security and employee privacy, I think that AI poses some unique challenges there around how that data is processed. And I think that's one of the reasons why I think that we're going to continue to see humans be, a critical part of the process here, because the data that we're collecting in this realm is incredibly sensitive and private, and we should be very careful about how we deal with it.
I think that's a good... Sorry, Kevin, go ahead.
Oh, I was just going to say from a slightly different perspective, I don't think AI is necessarily going to replace HR or OH straight away. But I think what
Straight
we're going
away,
to see,
I like that.
what we're going to see, certainly in the shorter term, is that certain roles within an organization might be more strongly affected by that. So whether that is roles within an organization disappearing completely, people having to be retrained, being redeployed, and then actually what the knock-on effect of that is, where workers might be concerned about that, they might be anxious about that, and then that might then manifest in terms of, higher referrals to OH, for example. And then again, that's a cycle which then goes back to HR, which talks about, well, how do we train, how do we manage, how do we upskill, how do we redeploy our employees who are particularly affected by that? So that is something also to be very much aware about.
I mean, there's a good point. Mary Ford shares a good point. She says she agrees with the above points, and also the fact that getting an occupational health management system or technology approved is very, very difficult, because a lot of executives or even IT teams are going to be like, nope, don't want to touch that. No, don't want a system where I'm having this type of data. And if you do want the system, here's a bunch of 700,000 requirements, and impact assessments. And she says she'd welcome any advice. Sam, from your experience, what's a good way to tackle that? I've got an IT InfoSec compliance team, and anytime I bring up anything related to occupational health systems, they're going to throw a bunch of, sorry for the language, mumbo jumbo, and it'll scare me away.
I think that finding the right partner who understands the industry probably means that a lot of your work is going to be done for you already. When you're operating in this space, it's important that, as a software supplier, it's important that you understand the data protection requirements in all the territories that you're working in. And I think that a good thing to aim for is find a technology supplier who understands your industry, because they'll likely have a set of they'll likely have done a lot of this work for you. And a good partnership between an organization and a technology supplier in this space involves sharing the burden of data protection impact assessments, among lots of other things. But I think certainly a good partner helps there in terms of making sure that you can get that procurement process through all of the right channels, and make sure that you're backed up by someone who can help you out there.
So is it just enough to inform my team that yes, they know how the nature of OH data protection is as a provider, so thank you very much, or is there some work I would need to do?
I think I would love it if it was that simple. But every organization will have a series of requirements that are usually driven by geography that state how data should be dealt with, and involving your supplier in the process there can again help you out a lot in terms of getting through it smoothly.
I mean, we've got a couple of minutes just left, but Ali Feely posted a comment and a question that I absolutely adore. It's a really powerful one. So we see a lot of companies implementing all the right approaches. Yes, when it comes to mental health and well-being, we're welcoming, we love you, we care for you, reach out if you need anything, there's everything. But then the rate of absence is still very high. People are still feeling the stress, the burnout, everything that's going on in the world. And then the data is in line with the average rates. So maybe, Kevin, that's definitely in your domain. How do I know if this is just me as an organization? I'm growing, or no, this is not just me. This is everyone just getting extremely stressed. Can I fix it? Can I know that this is our fault as a business? And versus, no, it's just the world is becoming harder for everyone.
Yeah, there's a lot to unpack within that question.
In a minute.
It's really
we've got 1 minute left. Go.
Ali, basically what I'll say is, yes, broadly, I think more people in society are struggling than before. That's not a good thing. I think the problem looking at averages is we have lots of organizations which can do better. So the average, just because others we're on par doesn't mean actually that others are necessarily better. The other thing also is lots of organizations do great on paper, but actually what that looks like in practice is a different thing altogether. You might have your OH provision, you might have your risk assessments, you might have a stress policy, you might have all the training programs which are being offered, but actually, are you evaluating how well they're being, what's the uptake of it? Are people actually engaging with it as well? And I think we often talk about effect evaluation. Did the intervention work? There's something else known as process evaluation. Did the process of the intervention actually work as well? And that sometimes involves asking about what are contextual issues. Of course, going through a pandemic will have a knock-on effect, but actually sometimes an intervention would work. I'm going to use a very simplistic example. I'm not going to debate, whether mindfulness works or not. Let's say it works in this specific context. Organization runs a mindfulness intervention, but actually it's supposed to work, but it didn't work. But actually, is it because people didn't have the time to attend that? Is it because it would have worked, but the trainer was actually not a good trainer? So there's lots of things to unpack within that. And that's a simplistic example that we can apply to everything else that we're doing. Is it fit for purpose, basically?
Brilliant. Thank you very much. I think that's a really powerful takeaway from for me as well. It's not just about focusing on measuring the outcome, but also the process. And we see some of the prevention programs that organizations do where you're being sent a letter in the mail, and then we say the outcome isn't really very powerful. Well, how effective really is a letter in the mail? But we're out of time. I enjoyed this more than I thought I would. Kevin, Sam, thank you so much for your time. Thank you very much for all the questions and the insights. I wish this was a lot longer. Kevin, this is definitely not going to be the last that we're seeing of you. And we're very, very excited for the white paper. For everyone on the call, thank you very much for taking the time. If you would like, please feel free to reach out to our speakers, Sam Wood, Kevin Teoh. You can connect to both of them on LinkedIn. And you can also reach out to our team if you have any questions or if you want a copy of the recording. Have a fantastic afternoon. Kevin, Sam, thank you again very much for your time.
Thank you.
Thank you, Sam. Thank you, everyone. Have a good day.
Thanks, everyone.